Hello, Nirmala ma'am.
All the best.
Hello, ma'am.
Hello.
Hi,
Thank you.
Ruli. All the best.
Madam, now we are going for YouTube live, so only relevant talk, okay?
Ma'am, we are live.
Yeah.
Sharing the Vandana now, ma'am.
Ganpati Vandana.
सरस्वती नमस्तुभ्यं वरदे कामरूपिणि विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा
गणनायकाय गणदैवताय गणाध्यक्षाय धीमहि गुणशरीराय गुणमण्डिताय गुणेशानाय धीमहि गुणातीताय गुणाधीशाय गुणप्रविष्टाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि एकदन्ताय वक्रतुण्डाय गौरीतनयाय धीमहि गजेशानाय भालचन्द्राय श्रीगणेशाय धीमहि
Hello.
Ma'am, please start.
Let's start the program.
Until you love yourself, you will never know who you really are and you won't know what you are really capable of. Good afternoon, all beautiful ladies of this group. With this famous quote from Louis Hay, I welcome all of you in this platform of Women Pediatrician Forum in this last webinar of this year. We women universally love and take care of everyone, but often forget to love and take care of ourselves. It is only when you have mastered the art of loving yourself that you can truly love others. We should take out some time to do what makes us happy. With this theme, we have planned today's webinar, which is our last webinar of this year for our fellow beauties with brains. Now I invite our chairperson, Dr. Sangita Lodha ma'am, for her welcome address.
Yeah. Very good afternoon to all the magnificents. I, Dr. Sangita Lodha, Chairperson Women Pediatricians Forum, welcome you all for today's 22nd and last academic series of the year. And this time we have chosen the most demanding topic of skin and hair care with few new faces as faculties. In 2025, we are coming up with a blend of academics and many more new add-on activities to WPF from the field of fashion, arts, culture, quiz competition, WPF Meet at Srinagar, Wisdom Pulse, community work, and many more new attractions and prizes too. Make more and more new members to the Women Pediatricians Forum. And now, this is our last webinar of the year 2024. And Happy New Year to all of you as well.
Thank you, ma'am. To moderate today's session, we are having a brilliant moderator, Dr. Nirupama Pandey ma'am. Dr. Nirupama Pandey ma'am is Director of Rajeshwari Healthcare and Nirupama Hospital at the Kohador. And she is gynecologist as well as pediatrician by profession. How magnificent she is. She is adolescent counselor and social activist by passion. She was chairperson of AHA in year 2020 and 2025. She was Joint Secretary of the Lucknow Academy of Pediatrics in 2021. She was also state convener of IAP Women's Wing. She was awarded Women's of Substance Award in 2022 and Chikitsa Ratan Award by IMA Lucknow. She was awarded for many social services from IAP as well as from IAP. IMA. With this, now I hand over to Dr. Nirupama Pandey, ma'am. Over to you, Nirupama, ma'am.
Thank you, ma'am, for such a warm and grand welcome and the blessings. So I welcome all the dignitaries here once again. और क्योंकि हम लोग लखनऊ से हैं तो थोड़ा सा लखनऊ की नवाबी के उसमें मैं थोड़ा सा आप लोगों के लिए कुछ दो शब्द कहना चाहती हूँ। आप सब डिग्निटरीज के लिए है ये। आप आए तो जगमग हुआ ये मंच, आप आए तो जगमग हुआ ये मंच, नजारों की अब कोई जरूरत नहीं है। न रोशनी की तरह महफिल में आप जो आए, रोशनी की तरह इस महफिल में आज आप जो आए, सितारों की अब कोई जरूरत नहीं है। So with this, these words, I welcome you all, and so today's I will welcome all the three speakers of today, and our state chairperson Sangita Lodha ma'am, our president Madam Anuradha Shandil ma'am. So, madam, please share the slides for introduction of our speakers. So today is a very important topic, and we have very dynamic and brilliant speakers today. And so today our first speaker is Dr. Smita Murli ma'am, and she is Junior Consultant Pediatrics, Kerala Government Health Services. She has been Chairperson Kerala State IAP Pediatric Dermatology Chapter 2024, Secretary Kerala State IAP Pediatric Dermatology Chapter 2021, 22 and 23. And pediatric dermatology workshop moderator, trainer of the Kerala State IAP 2023. And then she is ped dermatology faculty in various IAP district, state, national conferences and international NNF conferences. So we welcome you, ma'am, and we will benefit from your knowledge just now. So now the next speaker is again a very beautiful, dynamic, and she is also a very nice dancer. That is Dr. Roli Srivastav. She is retired scientist, RCH division ICMR. Then she is MBBS DACH from GSVM College Kanpur, and she is PG from DAP CDC Kerala. She is fellow aesthetic medicine Germany and master course in cosmetic gynecology Germany. And she is fellowship in face injectables from Sweden. She is MD Skin Miracle and advanced aesthetic laser anti-aging and wellness. She runs this advanced aesthetic laser anti-aging and wellness center Kanpur. So we welcome you, Dr. Roli Srivastav, and we will definitely benefit from your knowledge. And then our next speaker is Dr. Monica Sachdeva, and she is also very brilliant and knowledge in her field. She is DCH DNB IAP Fellowship in Neonatology, and presently she is consultant pediatrics and neonatology Alchemist Hospital, Panchkula. So we welcome you all, ma'am. And so I hand over the mic to Anuradha ma'am, please.
Thank you, Nirupama ma'am. Without wasting much time, I will invite our first speaker for today, Smita Murli ma'am, who
Thank
will
you very
deliver
much.
her talk on skincare.
Thank you very much, Anuradha ma'am, and thank you, Sangita ma'am, for inviting me for this talk. I had a very good time at Goa. I was invited to talk there. That Elizabeth ma'am invited me, and I was very tense at that time what to talk. But the presentation was very short, but they gave me such a warm applause, and they were all very interested. That showed that how much interest this topic has in a day-to-day life. So I thought, so the topic I chose is some moments of self-care. Can I share my screen, ma'am?
Yes, ma'am, please.
Is it? One second, ma'am. Is it visible, ma'am?
Yes, ma'am. Your screen is visible. Just open the
Okay.
presentation.
Okay. 1 second. I accidentally.
Yes, ma'am. Presentation
1
is
second,
about
ma'am.
to
It's
open.
not like thing is. Ma'am, I think you have one presentation, ma'am, and something.
Madam, I think Miss Pallavi will just share the
Share
slide.
it, ma'am.
Yeah,
Yeah,
that
yeah.
will be better.
There's
Yeah.
something happened, ma'am. It's not opening.
Okay, ma'am. Yes.
Ma'am, is it visible? Ma'am?
No.
No, not yet, ma'am. Just share again. Just
Okay,
click
ma'am.
on the share button again.
From share button, ma'am.
Yes, ma'am. Just click on the share button.
Okay. Then this
Then
one.
select
Ma'am,
your
is it visible
presentation.
now?
No, not yet, ma'am.
Pallavi, will you please play the slides to save the time, please?
Yes, ma'am.
Yeah.
Just a minute, ma'am. I'm opening the presentation.
जब हम बोले तो शेयर रिकॉर्ड कर लें.
Should I stop?
Yes, ma'am. Your screen sharing is already stopped. I'm sharing your
Okay,
PDF.
ma'am. I don't know, some multiple participants, something is coming up, ma'am, for me. Okay, thank you. So my talk is on some moments of self-love, daily skincare. Next slide, please. Next slide, please. Okay, so coming to self-love. When we say self-love, it's not selfish. It's an essential thing. It's there for our emotional, mental, and physical well-being. And loving ourselves is the foundation for sharing our best selves with others. So we should first love ourselves so that we can give our best to others. Next slide, please. So this is what. So I would say daily skincare, because we are so busy with our practice, with our families. I think daily skincare routine, which we follow, say for some 5 to 10 minutes in the morning and 5 to 10 minutes in the night. It's just, I would say, a powerful act of self-love where we can take time for ourselves and take care of ourselves. Next slide, please. So coming to this daily skincare, it is essential that we follow a daily skincare routine, because not only for maintaining a healthy appearance of skin and skin, it is also needed for improving the skin texture, tone. If it take care of our skin daily, it also boosts our confidence and overall well-being. And long-term skin health is also there. Like if we take care of our skin daily, routinely, then it will prevent dryness, acne, premature skin aging, and our skin will remain vibrant and resilient, and it will even recover and regenerate effectively from the aging, from aging. So first of all, in our skin care routine, first we have to understand our skin type. So how can you know your skin type? So to know your skin type, what you can do is you wash your skin, you can cleanse your skin, and after 1 hour, just feel your skin. If it feels dry, flaky, or tight, it's a very dry skin. If it's oily and shiny, it is a oily skin. And combination skin, we can say the T zone, that is our forehead, the nasal part, and the chin. So if it is oily, we can say it is a combination skin type. A normal skin type is not oily or dry after an hour of cleansing. And a sensitive skin, it can be itchy, red, or inflamed. So coming to the basic skincare routine. So how can we take care of a skincare on a routine basis, on a daily basis? For a normal skin, when you wake up, first we have to cleanse. We have to use a gentle cleanser. It is a soap-free cleanser that is easily available in market. So we can use a soap-free cleanser in the morning, first of all, at the first as a first part of skincare. Then always use a moisturizer soon after cleansing. It should be a lightweight moisturizer. It should be fragrance free. It should be like allergy free. Paraben is a this thing, what your preservative like thing added in the moisturizer, and it can cause contact dermatitis. So always use a moisturizer which is hypoallergic, that is paraben free, fragrance free. Even fragrance is a contact sensitizer. So we should use a moisturizer and always protect our skin with a sunscreen. A sunscreen of SPF 30 plus is what is needed. SPF 30 plus means you can 96 to 97% of the sunbeams, harmful sunbeams are being protected. So 30, even if you go to 50 plus or 80 plus now, they are available in the market. But 30 plus is well and fine. Even 50 plus means only 97 to 98% will be the sun blocking this thing.
Right.
So, and choosing an SPF of 30 plus is well and enough for our Indian skin tones. Next slide, please. Now coming to the oily skin, how to, for a person with oily acne prone skin, they can use a cleanser which has salicylic acid or benzyl peroxide. These are mild peeling agents which will help in reducing the oiliness of the skin. And if you are taking any medications, acne, if you are having any topical medication for acne, so after cleansing, you have to use the treatment drug. Like if you're using clindamycins or retinoids, you have to use that medication soon after cleansing. After that, you have to use a moisturizer. You can use a non-comedogenic moisturizer. For all acne-prone skin, always choose skin products which are non-comedogenic. So use a non-comedogenic moisturizer, and after that, you protect using a sunscreen, which is again broad spectrum sunscreen, which is oil-free and non-comedogenic. Next. Now, if your skin is of a sensitive type, I told you cleansing with a fragrance free. This fragrance is a very they are contact irritants. So always use fragrance free products for sensitive skin. Use a fragrance free gentle cleanser, and the moisturizer you choose should be hypoallergic, fragrance free moisturizer, and a broad spectrum sunscreen. So what are the do's and don'ts for a sensitive skin? If you have a sensitive skin, you should be gentle while washing and drying your face. Always use non-comedogenic products and minimize the means you're poking the skin, picking the skin. Minimize touching your skin in sensitive skin type, and don't use hot waters for washing. Always use lukewarm or normal temperature water, and don't wash your face more than 2 times a day. Because it will just take over the natural oils which are there. It will just wash up. So unnecessary washing should be avoided. Use products with do not use products with harsh chemical ingredients, and don't use product with fragrances. So for all skin types, what I will advise is a normal morning skincare routine. Okay. So as a morning skincare routine, cleanse your face, that is with massaging and rinsing, soft massaging with your pulp of your fingers. And you can use a toner. Toner is usually used for balancing pH and tightening pores. You can it's basically meant for acne prone skin to close the pores. And if you have any treatment products, if you are using like serum, vitamin C serum, if you are using for anti-aging part, or any treatment products for acne, etc., that you can apply after your toner. And if you are using any eye creams for your eye part, like normal eye moisturizing creams, anything, you have to apply that. After that, you apply the moisturizer. Then after the moisturizer, you apply your sunscreen, and any makeup will go after that sunscreen. So this is how you should use your skincare products. And in the night care, you have to remove any makeup and impurities before going to bed. You use your makeup remover, and some people, they use micellar water, that is pH balanced water, for cleaning the makeup. That is also good. Then you have to cleanse your face. And exfoliating, that is basically for acne prone skin and all, every 1 to 2 times a week we can use exfoliation with like alpha hydroxy acids, salicylic acids. These peels are available, glycolic acid. These are used for exfoliation that you can use for acne prone skin. And in dry skin, once in a week is enough. And other sensitive skin, better just some physical exfoliation with oatmeals, or just that will be enough. Normal homemade things will be enough for sensitive skin. And as an anti-aging routine, we can use serums in the night. The ones available in market are retinol. They are used for anti-aging, and vitamin C serums can be used at the night. And niacinamide, again, it's for a pigmentation. For getting over that pigmentation, we can use niacinamide serums in the night as a skincare routine, as an anti-aging routine for our skin. Yeah, ma'am. Next slide. So this is just to summarize. The day, you have to use a cleanser, toner, any antioxidant serum or treatment products, then moisturizer and sunscreen. In the night, you have to cleanse, toner for acne prone skin, eye creams and other treatment serums and peel. And moisturizer and night cream usually meant for dry skin. Okay. Next slide, please. So some tips, that is, main thing is we have to wear a sunscreen daily. Avoid picking and popping pimples. They can lead to scars. Keep your hands away from your face. Always stay hydrated. The first mantra in skincare is keeping us hydrated. Minimum 2 liters of water should be taken for a glowing, healthy skin, and get enough sleep. Next. And coming to some makeup tips, I'm not an expert. It's just from the net I have taken this. Keep it simple. Focus on enhancing your natural features. Choose hypoallergic and fragrance-free products. Avoid heavy foundation. Lightweight, oil-free formulas should be preferred. And highlight your eyes. Use mascara and subtle eyeshadows. Define your brow. Groomed brows frame the face. Wash hands before applying makeup. Remove makeup thoroughly before bedtime, and exfoliate once or twice a week. Okay. Then a little bit about nail care. Keep your nails clean and dry. Trim nails straight across. Avoid biting and picking at nails. Wear gloves when washing dishes, gardening, and harsh chemicals. Use nail polish remover sparingly. Brittle nails, if you have brittle nails, moisturize with nail oil and creams. And if it's weak nails, use nail hardeners. For thick nails, thin with nail files or drill. And when you choose your nail products, nail polish, choose formaldehyde-free options. For brittle and thin nails, the nail strengtheners containing keratin and calcium are available. And you can use, for flaky dry nails, you can use natural nail moisturizers containing argan oil and shea butter. And avoid excessive exposure to water or chemicals. Wear nail protection, like nail stickers can be used, and nails supplements containing biotin. Biotin is good for both hair and nails, so you can take biotin supplements. Okay, hair care. I have Roli madam. We'll be talking on it. I just go through some common things we can use in a day-to-day activity. Washing, we have to wash hair only when it is dirty. Avoid overwashing. It can strip your hair of its natural oils. Washing 2 or 3 times a week is sufficient. Avoid excessive brushing. And while shampooing, apply only to the scalp. Prevent stripping of it is to prevent stripping of your hair of its natural oils. Conditioner after shampoo is a must to help lock in moisture and to avoid tangles. And heat, if you are doing heat styling, keep the temperature moderate, and you can also use heat protectant sprays. Next. So some hair care habits that can damage hair are shampooing the length of the hair and skipping the conditioner, drying hair by rubbing with towel or using heat equipments, brushing wet hair, tight hairstyles, regular hair coloring, perming, straightening or relaxing, and applying long-lasting hairstyling products and wearing hair extensions can damage hair. Yes, ma'am. So to conclude, I think embracing the dairy skincare routine, I think it's an essential part of our self-love. We can take time to ourselves, take care of our skin, take care of our mood. We can take a better care of ourselves. It improves our health and appearance of skin. It will also give us a deep sense of self-care, self-compassion, self-appreciation, and mindfulness. Thank you, ma'am. So I was a bit tense. I hope I could just drive in the points there. Thank you, ma'am.
Nirupama ma'am, are you there? So I
Yes,
think
ma'am. Yes, ma'am. Yes. So the question answers will be in the last, ma'am.
In the last only, just
Yes, ma'am.
invite the next.
Thank you, ma'am. Thank you for a lucid details of and presentation. So now we welcome our next speaker, and that is Roli madam. So Dr. Roli Srivastav, please go ahead with your presentation.
Unmute yourself. Can you share the slides?
Okay, ma'am.
So today's topic, which I'm taking, is very near and dear to us, and why I've come into this aesthetics along with pediatrics. I would also like to share that till you share the screen. So I was doing adolescent pediatrics, and I was at GSVM Medical College, and I had an OPD for adolescent health in our government hospital. That is the Hallett Hospital. And while doing that, I had adolescents coming to me with low body image issues and depression because of some of the or the other skin ailments. It was PCOS mostly, but also acne and acne scars. And that led me thinking that what do I do to help them? And especially the hirsuts. So that led me to learn aesthetics more, and ultimately then transform your skin and transform your life happened. And it's started with adolescents, but now it caters to everyone. And where we can move to the next screen, next slide. I can't change. So yeah, I did all this, and especially today's talk is for our women doctor pediatricians who are attending this. And next, please, as the menopause approaches, so a lot of skin issues are there. I see people who've never had acne in their lives suffering with acne and acne scars and hair fall, and helping them really makes them happy and makes me happy too. So this importance of healthy skin, we all know it boosts our self-confidence, and the glowing skin and makes us happy. We are more comfortable. It improves our mental well-being. The acne, eczema, and acne scars in adolescents, as well as in any of us who suffers with this, it could be male or female, adds to the anxiety, and people are looking for some DIYs or something to help yourself. Next, please. So it does affect our mental well-being. It represents internal health. It's a reflection of overall health. It is a reflection of your love to yourself. It is an investment. Skincare is an investment. If you're hydrated, have had good nutrition, it all reflects on your skin. And the proper self-care routines.
and it helps improve your social interactions, improves your relationships, and radiant skin, people and you both are, people appreciate it a lot. Next, please. So it helps in professional life as well. So it creates a very good first impression. And then there are certain careers where it is very important, like next slide. So like if you're in a beauty industry or in fitness industry or in modeling, acting, so skin care and good skin and good looks really are very important. And with good skin, I don't mean the color of the skin. It means the even tone. It means the flawlessness. It means the blemish, no blemishes, and less of wrinkles. So it does reduces your stress and improves your productivity. It reduces your use of makeup as well. Next, please. So skin aging. So as the child borns, right from the first moment of his birth, his or her birth, the child starts to age. And aging could be chronological, that is genetic and biological, and could be because of the intrinsic factors, and extrinsic, that is the environmental factors. So with the chronological aging, there's thinning of the epidermis, there's reduced production of collagen and elastin, which causes loss of firmness and elasticity. There's slower skin cell turnover, which causes dullness of the skin. Their fine lines and wrinkles appear because of their emotional characterization of the face. Next. So extrinsic factors, which are mostly responsible, are the sun exposure, that is the photoaging. UV rays are the main culprit, UVA and UVB. So when you are choosing your SPF, that is the sunscreen, you must see that it has both UVA and UVB and infrared protection as well. Pigmentation, wrinkles, and uneven tone. And these days, overuse of mobiles and the LED lights, which we have in our consultation rooms and home, are also responsible for the photoaging. Pollution, which causes free radicals, causing oxidative stress and skin barrier damage. The lifestyle habits, smoking, poor diet, the late sleep, the overuse of mobile, all of this causes premature aging. Stress increases cortisol level, affecting the repair mechanism. So how the what age you want to look entirely depends upon you yourself. So this is how the young skin gradually gets converted into the aged skin. Chronological aging as well due to pollution and the UV rays, which are the main factors. So you can see here the epidermis is thinning. This collagen and fibroblast and elastin have decreased in the aged skin, and this melanocytes have increased, and sensational epidermal and fibroblast cells have also decreased. So collagen is the scaffold of the skin. It prevents it from falling down. So as we approach menopause, or as we age, this scaffolding, the pillars get sluggish and skin starts going down into gravity. It sags down. And then elastin also decreases, as well as, next slide, please, hyaluronic acid. And therefore, this whole aging process, it is on the face. Skin is sagged, the elasticity is gone, and the hydration is also grossly reduced. So at the molecular level, the collagen, which provides the structure, is gone. Elastin, which ensures elasticity, is reduced, and as well as hyaluronic acid is reduced. So there's sagging, there's wrinkling, there's decrease in hydration and plumpness, and free radical damage, which could be due to fast food eating, due to excess mobile, due to a lot of stress, and lack of exercise and lack of sleep, causes accelerated and premature aging. So the preventive measures, so as my learned previous speaker emphasized, that sun protection, it should be at least two fingers full, and at least 2 to 3 times during the day in extreme heat, and in winters at least 2 times at the interval of 4 hours. And this is the one important measure. People ask me, really, give me one tip, and that is the proper and effective use of sunscreen SPF 50. Wear protective clothing. You can wear a cap, shades, and as well avoid the peak hours. You can cover yourself with a dupatta. Healthy lifestyle, balanced diet rich in antioxidants and free radicals, and I actually promote a lot of beetroot juice with amla these days, and drink it as much as you want, and it really shows on your face. Adequate hydration, regular exercise to improve circulation, the quality sleep of 7 to 8 hours for skin repair and regeneration is extremely important. Skincare routines have been talked of, but with aging, you need to add retinol, peptides, and hyaluronic acid supplementation for topical use on your skin. And regular 1 to 2 times a week exfoliation does improve your skin texture and improve cell turnover. Next. So these are few measures. I'll go one by one. That is my favorite, beetroot and amla juice. And I recommend it to everyone because I drink it every day. And you can add a bit of haldi and black pepper to it to improve this quality. And take it fresh. It's very tasty, and it gives you all the antioxidants you need. Then walking, nothing better than walking. Even if you have some knee pain, even if you get tired easily, if you cannot jog, you cannot exercise, but then 40 minutes of walk, however slow it could be, however brisk it could be, but it does decrease your cortisol, improves your happy hormones, and improves your skin texture and color, and decreases aging. This is how to protect yourself during summers. And this is one exercise. This is Cobra Asana, which is very good for your necklines, for your jowling, and for your firm skin. So, as of the whole Surya Namaskar is very good, but especially this asana helps you for your neck and jawline and for skin. This is face yoga as well. Next. Then laughing at yourself, laughing with others, and being happy is very important. So even if you do not get chance to laugh, there's a laughing exercise which one must do. And then having a bowl of vegetable soup, chatting with friends, discussing things, decreases cortisol, and a good, healthy, protein-rich breakfast has a very important role, because collagen and elastin are nothing but proteins. So if you can decrease your salt, decrease your sugar, and improve your protein, your aging will definitely halt, will definitely, and your many of the anti-aging procedures, the requirements will decrease, and a good night sleep is very important. Next. So aesthetic treatments for skin aging, non-invasive treatments have chemical peels, especially the yellow peel, microneedling, stimulates collagen production, improves fine line scarring, and one of my most favorite treatment. And I'm a pediatrician, so I have a painless hand, and clients really love the results I give by microneedling. Laser resurfacing and botulinum toxin, which decreases the wrinkles. Next. So these are the pictures of some of the procedures. The first one is the hydrofacial, which exfoliates your skin, and cleanses, exfoliates, and then hydrates your skin. And it has we add more of serums for ultrasonic and good skin tone. This is chemical peel. This is AHA, BHA for exfoliation, and these are customized peels as the skin requirement is. But retinol or the yellow peel is important for the anti-aging skin. Then this is PRP, which is another game changer. With PRP, with microneedling, works very good. It gives very good results. Next. So now we come to some other treatments which may be required as an anti-aging treatments. They are dermal fillers. They are PRP, that is collagen induction therapy. Thread lifts, they provide a lifting effectively in certain by threads. Regenerative therapies are stem cells, exosomes, and then we have high frequency ultrasound again for facelift and neck lift as well as body lift also now. Next. So thread lifts, they are same absorbable materials which we use for sutures, and that is polydioxanone or PDO threads as we call them. And they continuously stimulate synthesis under the skin. They act as foreign body, and as you insert them like this, they physically lift your skin immediately, and then gradually they have barbs, so they help the skin from falling down against gravity, and the good results are seen within 3 months and stays for 18 to 24 months. And if you keep continuing with some maintenance treatments, the effect lasts for a long time. Next. So benefit that is there's very no need of expensive painful surgeries. It's much cheaper also, and there's minimal downtime and lasts for a long up to 2 years. It improves your own collagen. There's nothing synthetic. There's nothing. It's a chemical. It's all they are just the triggers. It improves your own collagen production, improves tissue elasticity, fibroblast stimulation, angiogenesis, and thereby increasing the blood supply and collagen elastin formation. Next. So these are some pictures of the thread lift. As you can see, these are cork threads where the line on the first picture, and you insert the thread and you just pull it. So these are pictures taken out from the net. They are not my pictures. I was traveling, I couldn't put mine. So there are pictures from the net. The names are already there from where I've taken them. So these are they give physical lift as well as the lift goes on to appear for better for 12 weeks. So there could be jawline, there could be nasolabial, there could be marionette lines, double chin, eyebrows, any of the areas of the face can be lifted, as well the necklines. So breast can also be lifted by similarly, and the butt can also be lifted similarly. And the other picture has mono threads. So these are small threads, and one just inserts them and remove, and they're very easy to put and give good effects. Next. So this is one such result which was posted in on Google, and the result actually it comes like this. So you can see how how impactful this procedure is. Next. So these a word about fillers. Fillers are again, they are non-invasive treatments. Next. So there are different kinds of fillers. They are hyaluronic acid. That's the next slide. So for any of these problems, from the under eye fillers to marionette lines to plumb your skin to lift your the sad face, and to improve the texture, the deep lines on your forehead, anywhere we can use fillers, and depending upon the cross linkages it has, we customize. And then these days skin boosters are also going on, which also help a lot in overall improvement of texture and anti-aging of this face. Next. So there are types of fillers. There are some synthetic, and then there are some natural fillers. Natural are autologous fat transfer, where they remove fat from one part and inject on the face. So, and rest are the synthetic fillers. That is hyaluronic acid. It has the quality of absorbing water. So it just hydrates your skin, plumps your skin. So all the fine lines and deep lines are improved. Then calcium hydroxyapatite, polylactic acid, and PMMA. These are PMMA especially has collagen in it, and it all helps you create collagen and improves your fine lines and wrinkles. Next. Fillers last for 9 months to 2 years, depending on the quality. Then exosomes and PDRN. Next. They are a game changer. Next. So PDRN is a DNA-derived drug, while exosomes are very nano particles. So PDRN is used to promote wound healing, tissue repair, and skin rejuvenation, and it is an injectable, which and exosomes, they deliver active ingredients, and we do microneedling, and then we inject exosomes as well as we can do microneedling with this. So how they work: PDRN promotes the growth and activity of fibroblast and thereby increases your collagen elastin, while exosomes, they themselves, they promote by their messenger cells. So exosomes, they promote your skin to produce um, um, fibroblast and collagen and elastin. Next, a word on botulinum toxin, which relaxes your muscles and decreases the fine lines and wrinkles on your face. Next, so as it's read, it's temporary. It lasts 4 to 6 months. There are other medical conditions where it helps. It also helps in vaginismus, in cosmetic gynae conditions. It also helps in migraine, overactive bladder, neck spasm, eye problem. In fact, any chronic pain, you can just inject on the muscle causing the pain, and it relaxes that muscle, and pain is relieved immediately or in 3 to 4 days. Next. So when you inject Botox, the result comes in 7 days. Next. So after getting these good, nice anti-aging treatments done, what do you do to maintain them? You can take some anti-aging medifacials in 2 weeks, 2 months time, 4 weeks to 6 weeks time. You can have a LED therapy or a photon therapy. You must use topical antioxidants, retinol. There are some synergistic effects. Combining PRP with microneedling or exosomes give wonderful results. So customized treatment depends on individual needs and ensures effectivity and safety, and it is less on your purse too. Thank you so much.
Thank you, Dr. Roli, for a very nice and practical presentation. I must say everyone must have been enlightened with your talk, with your beauty regime, and will definitely benefit from it. So now I invite our next speaker, uh, Dr. Monica ma'am, for her talk. So Dr. Monica ma'am, please continue with your presentation.
Good afternoon, everyone. Can I have the slides loaded? Good afternoon, seniors and colleagues. It's a great opportunity that I've been given today to talk about hair care, which is actually very close to my heart, because my hair is one mess that I have. So I always thought maybe actually reading more about hair care, talking to my dermatologist friends might actually help my own hair. So I have my seniors who have spoken so well already more about hair care and aging. And it is just to add on a bit to their expertise. I'm not an expert like them, but whatever I can, let me talk to you about hair care myths that we will debunk today. So let's explore common hair myths and discover the truth about achieving healthy and vibrant hair. Next. So we'll talk about myths versus the facts. A myth is we'll talk about the myths, most widely held beliefs about hair care, which are actually false. And we'll delve into them and talk about how to actually go on to a journey to healthy hair. Next. Now, there's a myth that frequent shampooing causes hair loss. Now, shampooing doesn't cause hair loss. While shampooing removes dirt and oil, it doesn't directly cause hair loss. Hair loss is due to genetics, hormonal changes, or medical conditions. So, a healthy scalp will lead to healthy hair. Proper shampooing and conditioning actually keep the hair healthy, prevent hair loss, and which is caused by buildup. Next. Now, proper shampooing and conditioning is essential. Gentle cleansing is required. Use a shampoo formulated for your hair type and wash your hair every 2 to 3 days to maintain a healthy scalp. Conditioning that helps replace moisture lost during washing, keeping hair soft, smooth, and manageable. Balance is actually a key. Avoid overwashing, which can strip natural oils from the hair, leading to dryness and breakage. There's a myth cutting hair makes it grow faster. Now, the hair growth cycle is determined by genetics and internal factors, not by cutting. Trimming split ends doesn't affect hair growth speed. Healthy hair lead to faster growth. While trimming doesn't directly accelerate growth, it prevents split ends from traveling up the hair shaft, promoting healthier hair growth. Now, split ends actually travel. Split ends which are caused by damage can travel up the hair shaft, weakening the hair and leading to breakage. Preventing further damage is by trimming, and it helps prevent further damage and allows hair to grow longer and healthier. Regular trims is required every 6 to 8 weeks to maintain healthy hair and prevent splits from forming. There's a myth, brushing hair 100 strokes per day is good. Now, excessive brushing, that is brushing too often or too vigorously, can actually damage the hair shaft, leading to breakage and hair loss. Gentle brushing is required. Brush your hair gently, starting from the ends and working your way up the roots to avoid pulling or tugging. Listen to your hair. Only brush your hair when needed and avoid overbrushing, which can cause unnecessary damage and stress. Now, first, we minimize friction. Using a soft bristled brush helps reduce friction, minimizing damage to hair cuticle. Detangle very carefully. Use a wide tooth comb to gently detangle knots starting from the ends and working your way up. Limit brushing. Brush your hair only a few times a day to maintain healthy hair and prevent breakage. Using hot tools. There's a myth that using hot tools won't damage healthy hair. Heat damage. Using hot tools without proper heat protection can cause significant damage to the hair shaft, leading to dryness, breakage, and split ends. So use a hair protectant whenever you need to use hot tools. Always use a hair protectant spray before hot styling tools to prevent a barrier between the heat and your hair. And always lower the heat settings. Use the lowest heat setting possible for your styling tool and avoid prolonged exposure to heat. Now, hairstyles that promote length and shine. Loose braids. Braiding your hair overnight prevents friction and tangles, minimizing breakage. You can always use a low ponytail. Secure a low ponytail with a gentle hair tie to avoid tension and pulling on the scalp. Protective styles. Styles like buns or twists can reduce daily styling and minimize heat damage. Insider tips for hair hydration. Deep condition. Apply a deep conditioner to your hair at least once a week for intense hydration. Rinse with cold water. Avoid hot water. Cold water helps to seal the hair cuticles, preventing moisture loss. Avoid excessive heat. Use heat protectants and minimize heat styling to prevent damage and dryness. Now, how to tame frizz and flyaways. Humidity control. Use a frizz-fighting serum or cream to lock in the moisture and prevent frizz. Moisture balance. Ensure hair is properly hydrated to prevent dryness and frizz. This moisture is not only from the outside, but also from the inside. So plenty of water, plenty of hydration to be taken, plenty of fluids to be taken throughout the day for good moisture. Silk or satin. Use silk or satin pillowcases to avoid friction and minimize frizz. Now, techniques for color treated hair. Almost all of us use color nowadays. So color treated hair, use color safe shampoo. Use a color safe shampoo and conditioner to prevent fading and protect your hair color. Deep conditioning. Hydrate your hair regularly with deep conditioners to combat dryness caused by coloring. Sun protection. Use a hat or use a UV protectant spray to prevent sun damage and color fading. Now for scalp care. One is you exfoliate. Regularly exfoliate your scalp to remove buildup and promote healthy hair growth. Massage your scalp to stimulate blood flow and promote hair growth. And third is hydrate. Apply a scalp serum or oil to nourish and moisturize your scalp. I spoke to many dermatologists regarding oiling of hair. What opinion they had was oiling to be done before washing of hair and not to oil after washing so that it's not greasy. Now, troubleshooting some common hair woes, hair loss, considering a dermatologist, dandruff, anti-dandruff shampoo, and healthy scalp split ends, get regular trims. Now, understanding your hair is important. Determine your hair type, straight, wavy, curly, or coily. Consider your hair thickness, density, and porosity. And understand your hair's individual needs, the moisture, strength, volume, or frizz control. Consider factors like climate and lifestyle. Now, coming to the hair signs, as we all know, hair growth cycle, we know about the stages of hair growth, the anagen, catagen, telogen phase, and understanding the cycle helps us optimize the hair care. Now, hair composition, hair is made of keratin, a protein. So we need to nourish hair with protein-rich ingredients for strength and shine. And that protein is not only from the outside, but from the inside. So more of proteins, adequate proteins per kg per day is important for good keratin. Hair structure, explore the structure of hair, cuticle, cortex, and medulla. Understanding each layer allows you to address specific concerns. Choose a shampoo.
I think ma'am ma'am has network problem.
Dr. Monica, you are not audible.
Ma'am, Monica ma'am is
We
not
can
there.
take question answer session.
Okay, ma'am.
Yeah. So we will
Rapid
take the
fire.
time
Should
and-
I start rapid fire, ma'am?
Yes.
Okay, so all the dignified speakers, and this is open for audience as well. There are a few questions of rapid fire which you have to just answer yes or no, or if required, only short elaboration. So starting, here is the first question that it is related to the hair care. Whether dandruff is a result of dry scalp? Dandruff is a result of dry scalp. Yes or no? Anyone can answer it. Dandruff is...
It's seborrheic dermatitis basically. It's basically the seborrheic dermatitis of the scalp. It's like an eczema. So they have this oily scalp, and and the drying of this plaques, it is that causing this thing. It's not dry scalp. Basically, it's the eczematous condition
correct,
of the
ma'am.
scalp.
Correct. So next question is also related to hair. That hair can tell about your nutrition, vitamins, whatever drugs you have taken, or medicine intake. True or false?
Yes. True.
Yes, correct. So another is related to skin. Sunscreen is not required in evening or on cloudy day. It's only for sunny days.
Oh, every time.
Yes.
All the days.
Yes.
Daytime.
Yes. That is
Also at night.
Yes.
Also at night.
Oh,
Sometimes.
also at night also.
Sometimes when you have melasma or hyperpigmentation, and if you're using too much of screen, then at night you must apply on those patches.
Okay, that I heard. Yes. So then another is related to hair again. That natural oil is enough for hair. No added oil is required. So that is oiling which we do on our heads. Whether it is required or natural oil is enough.
Maybe you must do it once in a while. It improves.
How frequently?
Once a week maybe, and it should not be kept more than an hour. Just If you oil your hair, oil your scalp, massage it well, but you must wash it after 1 hour with just lipid warm water and then apply hair serum.
I spoke to many dermatologists, and they were of the opinion that some oiling to the scalp is needed for good blood circulation. And after that, hair needs to be washed, but no oiling post washing of hair.
Yes, that is correct. Yes.
Dr. Sangita, if you are online, then you can start from the
Right, ma'am.
slide. You can
Okay,
take.
ma'am.
Yeah.
Yes, ma'am.
Ma'am, please go ahead.
Yeah. Just to save the time, we just took over.
Ma'am, actually, I'm traveling, so there is some problem with the
Will you
signal.
please share the slides again from where she has left? Please. Yeah.
So we already talked about the shampoo according to hair type, conditioner to be applied from mid shaft to the ends. Now this smooths the cuticles, detangles and provides moisture. And hair mask should to be used at least 1 to 2 times a week for extra hydration, nourishment and strengthening. So power of ingredients, this is very important. Moisturizing, essential for healthy hair. Look for ingredients like shea butter, cotton oil, and aloe vera in the products that we use. It should be protein rich, strengthen hair, prevent breakage. Seek your ingredients like keratin, collagen, and silk proteins. And proteins, again, as I said, not only from the outside, but from the inside as well. And antioxidant rich food has to be taken, plus antioxidant rich chemicals need to be applied. Protect hair from damage caused by free radicals. Look for ingredients like vitamin C, vitamin E, and green tea. Now, styling techniques, blow drying, use hair protectant spray. Try not to use blow dryer if possible. Curling should be decreased. Braiding, this create intricate braids or plain simple plaits for an elegant polished look. Next. I think we already talked about this. Next. Now, embracing natural beauty is the most important. Love your texture. Whatever you have, love it. And that love is going to show on your hair. Embrace your hair's natural texture. Discover products and techniques that enhance it. Find your style. Experiment with different hairstyles that complement your face type and personality. Express yourself. Use hair as a canvas for self-expression. Explore colors, accessories, and unique styles. But try to stay away from chemicals as much as possible. Excessive heat can cause damage, so limit blow drying. Use of tools like flat or curling irons. Heat settings, low or medium heat settings, and a product to protect your hair from heat. Now, the most important is hair health and lifestyle. With this presentation, I discovered there are two things which actually affect the hair. One is internal, that is the genetics. The genetics we cannot change. The second is how we actually handle our hair and our own body. So if we have a healthy lifestyle, we have healthy hair. Exercise is important. It helps to promote blood circulation, delivering nutrients to your hair follicles faster. Sleep is necessary for your body to heal and repair itself. Hair cell regeneration is just one of those repair processes that occur while we sleep. Stress management. Stress is the leading cause of hair loss, and high cortisol levels can disrupt hair growth. Now, hair-friendly diet, proteins. Proteins make up for bulk of your hair. So incorporating a diet with high protein will help counter any deficiencies that you have that result in brittle or thin hair. Vitamins are essential to your hair health, aiding in various ways. And omega-3 fatty acids. They are amazingly beneficial for your hair, helping to increase hair thickness, reduce inflammation associated with hair loss, nourish hair follicles, and improve circulation of other nutrients. So for hair loss prevention, important is a healthy lifestyle, balanced diet, and gentle hair care. So the important takeaways from this discussion should be, we should be knowing our own hair type and choose the right products that suit us and not according to what is there in the ads and everything. heat protection, limit heat styling and use of heat protectant products, gentle care, be gentle with your hair, especially when wet, to prevent damage. And very important is a healthy lifestyle. A healthy lifestyle, including exercise, sleep, stress management, and a balanced diet, is crucial for hair health. Thank you.
Thank you, ma'am, for a nice presentation and ma'am, debunking the myths, various myths related to hair care. So now, uh, uh, ma'am, should I continue with the rapid fire? Only few questions are left.
Question answer session.
Okay, okay. So, a few questions, rapid fire is there. Acne is a result of eating oily foods, spicy foods, and chocolates. True or false?
No, it could be true because it's seen that more of sugar intake and more of dairy intake increases the onset of acne.
But actually, acne, the basic pathophysiology is that it is the result of hormonal imbalance which causes
It-
the increase. Yes.
Yes, but accelerated by eating lot of sugar and dairy. So if you want
So
to,
balance should be there. Yes.
yeah, if you want to,
Anything in excess, yes. Excess is anything in excess
excess
is
of sugar
dangerous.
and dairies are actually stopped if you're having a lot of acne.
Okay.
And nowadays, lot of people are using steroid products for fairness and all. And
Yeah.
the steroid acne is one thing we are seeing a lot. And using oily products on the face, we should know your skin type and use products. Sometimes they use oily products.
So one question related to this only. Oily skin doesn't need moisturizers. True or false?
No, oily skin. There are oily skin does need moisturizers, ma'am. And there are products which are non-comedogenic for oily skin.
Okay. Okay. So then next question. Antibacterial soap is best for keeping skin healthy.
No.
Should we use it?
No.
No.
Like you have to use a pH-friendly soap. Acidic pH soaps. That is what
Some
ideally we
bacteria
say.
even, yes.
Yeah, the pH should be acidic pH. Our skin is, or it will like all these antibacterial soaps have a alkaline pH, and it just disrupts the skin. What you say, the skin
Normal flora, yes.
flora,
Yes.
and it can cause dryness.
Okay.
Yeah.
Yes, correct. And then they can exacerbate some infections also because there are some bacteria also which are
the skin
Barriers
flora
are
is
broken.
defective now, and it
Skin,
is
skin barriers are broken.
that is it.
It
So no
invites
unnecessary use of antibacterial this
and
thing daily.
they should be washed only twice, once in the
Yeah,
morning, once
that's
before sleep.
Okay.
Clean
Okay.
it over.
Okay. So and this comes to this rapid fire questions and then there were some questions by the dignified audience, and so please just clarify them. One is a cleansing agent for girls and boys with underage girls and boys.
cleansing.
Cleansing agent,
Yeah,
yes.
cleansers are available, ma'am, for all age groups. It's like common only. The pH balanced cleansers are available. Cetaphil cleansers, Moisture X body wash cleansers, all are available in market. Standard companies cleansers are available. It can be used. Yeah, we give cleansers for babies also.
Sometimes when patients cannot afford good cleansers, I request them to use besan and dahi for
Yes,
all.
yes.
So that lactic acid is an AHA and besan is a cleansing agent. So I ask them to keep it on their shelf and it helps a lot when they come.
Provided they don't have allergy, because I myself used it. It was very good cleanser, but sometimes I developed few.
Yes, Roli, I want to ask you that with adolescent with acne, can we advise besan and what you said, dahi
Ma'am,
or what?
no, ma'am, not with
Hmm.
acne. When acne is like with active acne, you have to be very cautious. For scars, once they for scars, you can advise if they are not able to afford anything. But active acne, you have to be very careful. You have to use BPO, benzoyl peroxide gels and clindamycin washes and clindamycin cleansers.
Yeah.
And because for active acne, you have to be very careful. Because
And what
anything,
about the sunscreen for these acne prone patients?
ma'am, we have, you can use any sunscreen. It should not come.
Can you please share with few brands, if at all
Yeah,
it is possible?
yeah, gel based. I use, there's a sun mist, there's sun armor. Both go very well in my clinic for acne cases
These
also.
are from pharmaceuticals or any cosmetic
Ma'am,
companies?
No, ma'am,
my
they're not, no, they are all medicated and therefore from all, and they're available online. That is why I'm speaking this out.
Can you please
as a
share in the
prescription,
group?
ma'am,
Uh,
prescription.
I will do that. And then there are non-comedogenic acne moisturizers also
Yeah,
from
please share.
very reputed companies.
Yeah.
So
Mm.
you can just type and you can get it online and they should be promoted. Active acne, you really don't need to do much. You have to start medication and let
Yeah,
it.
The nail
cool
hardener
down.
products.
Can I, can I, can I, ma'am?
Yes, yes.
Yeah, in
Yeah.
what I prescribe is photostable acne sunscreen gel is available. Sun Pharmaceuticals. That's what
Yeah,
I use.
can you share, madam, name in the
Yeah,
group?
yeah, name. Okay,
Yeah,
ma'am.
please.
Madam,
Please,
can you
thank
please
you.
share it
Okay,
in the chat box so I can just upload it
okay,
Yes,
in
ma'am.
YouTube
yes,
also?
yes.
I'll just share it, ma'am.
Please.
Photostable acne sunscreen gel is what I give to my patients. And other thing, moisturizers, Moisturize Hydra is there. Epilino is there.
Mm.
Episoft. There are a lot of Venusia Derm is also there. All these are
Yeah.
non-comedogenic moisturizers, ma'am.
And what about night
Standard,
cream for acne prone?
ma'am.
Night creams for acne prone girls.
Basically, I give. There is one thing I use is VCX serum, vitamin C plus ferulic acid. So it is some peeling
Which one?
action of
Pardon, please.
VCX
Which
serum.
vitamin C
VCX,
and
vitamin C plus ferulic acid. I give
verulic
it
acid?
like it will also take care of the scars also, ma'am. And it's a
Yeah.
rejuvenating serum. I use
Yeah,
it.
yeah. Please share the name. Please share the name
Yeah,
if you
yeah,
don't
yeah.
have any problem.
Okay, ma'am.
So one question was in chat box: how frequent the hydra facial should be? How frequent should be hydra
Ma'am,
facial?
at every 21 days you can take, not before that. Any skin treatment requires 21 days is the skin cycle. So 3 weeks to 4 weeks before that, we don't do anything. It
Cost of
could be
thread lift?
cost of
Thread lift.
thread lift. Now depends upon the thread you choose, but basic PDO cog threads, around 20,000 for 8 threads, 8 to 10 threads. 8 threads, 20,000.
So deep
And
con-
what about androgenic alopecia?
Androgenic alopecia, ma'am.
Mm.
Again, we treat it with the, if there's alopecia areata, we give kinocot injections, and then GFC helps a lot in all alopecias. So GFC we
Okay.
prepare with your own blood, that is PRP. Then
Yeah.
there is another product which has come in the market, that is QR678, that can be injected, and there's another product, exosomes can be injected. Follicle exosomes are there, and these
Mm.
exosomes are human derived. So they also very good results in 3 sessions, 3 GFC, 3 exosomes, and then you wait for some time and then you can repeat it again. The hair
deep
fall
Okay.
decreases and hair thickness improves.
Does these products have good results or fairly good, or what you would say?
Ma'am, GFC we are preparing at our own. So result definitely depends on what you're eating and what serums you're applying and whether you're applying
Mm.
minoxidil and your daily routine. Everything affects and your stress level and your sleep. So it cannot be, the same result cannot be guaranteed
Oh,
for
yeah.
everyone. But if extrinsic factors are under control, then it does help.
Oh,
Okay.
thank you.
I'm
Monica
happy
ma'am,
with drugs in PCOS.
what do you mean by deep conditioning? Monica ma'am, are you there? Deep conditioning you mentioned.
Who is going to give the answer of this question?
Any role of oiling? ऑयल तो कहीं आया ही नहीं, दादी नानी के जमाने से ऑयलिंग चलता है. So any
Yeah,
role of oiling?
we did speak about oil. Oiling and massaging the skin is also good. And when people ask me कि रोली एक चीज बताओ जो हम रात में कर लिया करें, हमें ये सब नहीं करना, तो I do advise you apply coconut oil on your skin and give a 5 minutes good massage to your skin, good to your face. every night if you're not acne prone, because sometimes with menopause the acne appear. So if your skin is non-acne prone, so apply a coconut oil raat mein on your face will glow after some time.
And for hair, scalp?
For hair also, ma'am, same. Not every
Scalp.
day, but hair oiling has to be done once a week. Once a week, but hair serum every day, morning, evening. Hair serum every day if you're having hair fall, and there's some anti-frizz serums also
Any
available.
specific type of serums you advise? The names?
Ma'am, so many companies come to us. I can't specifically say, but yes, there is some Tricomedic by Lodha company, and there are these days hair supplements also, supplements focused only for hair, which you take once a day or twice a day, and they are also very effective, ma'am. They're in a cycle pattern. Like on Monday you take, then Tuesday you take. There are 6 bottles, and day wise they are there. So they also give very wholesome treatment and the holistic approach to lifestyle. It helps a lot with aging skin and hair fall. PCOS, generally people are very benefited because PCOS young girls are too much affected, and then lasers also helps a lot in PCOS in bringing back that zinc to their life in hirsutism and all.
Okay.
Okay, so I think the question answer, that's the end of the question
No,
answers.
there's someone asking that PRP is not protein-rich plasma, it is platelet-rich plasma. So PRP is injected on your scalp as well, it is injected on your face, both. And PRP is also injected wherever you require rejuvenation, chronic pains, and everything is also. So PRP is the golden elixir. It can be used. It is by your own blood. You centrifuge at a certain speed, and you get PRP. And if the special tubes are used, GF4, then you get GFC out of it. That is growth factor concentrate.
Okay, thank you, ma'am.
There was
Is
a question
keratin
about deep conditioning.
Yes, deep conditioning.
Yeah,
Monica ma'am,
I'm
is
sorry,
there?
there was loss of some signal, so my answer could not go through. The best way of conditioning is one should apply the conditioner or hair mask. Hair mask can be applied even to the scalp, while conditioner has to be applied from mid shaft onwards. And then if we actually have a few towels with us which are into warm water, warm water में रख के, if we keep those towels one by one, that is actually deep conditioning that happens for your hair, and then wash it off. So that will give a good texture, and conditioning is going to be deep. Best with a hair mask, which actually suits your hair type.
How long to apply the hair mask?
Hair mask can be applied for a few minutes. Once we apply the hair mask, at least 2 to 3 towels of warm water we need to actually put in our hair, keep it for some time, then change the towels 2 to 3 times, and then we can wash off our hair.
Yes, we have also, when we were having this age-related hormone disturbance and hair fall, then we were also advised that apply gentle massage of the hair with the oil, and then just putting this wet, warm water towel for around, as ma'am said, for few minutes, and then alternate, remove it, and then alternate. So 2-3 times every time, and then after waiting for some time, wash it, and it, yeah, definitely it gave good results for falling of hair, as well as the gave good conditioning also.
Rukma, somebody has asked what are the side effects of laser hair removal. So laser hair removal, if done with a good machine, with good hands, is very effective, both in the age, near the menopause, when people start growing hair because of the lack of estrogen, as well as in PCOS, as well otherwise also, and there are no side effects. Sometimes one may get burn if the hand is not trained, I should say. Machine and trained hands give very good results. And so there's people who have complimented me. So I would say ki yes, everyone is invited. If you can come to Kanpur, you'll I offer you some great treatments. I've learned aesthetics, so
रोली
very
एक
happy.
एक स्टॉल पेटिकॉन में लगा दो.
Yes, yes.
Madam,
Yes, I second it. I second it. Only
Madam, we can do it in Women Pediatricians Forum conference. Definitely, good idea.
So that is the end of the question answer, I think, formally, and then further questions can be dealt in the group.
I just wanted to
So-
ask one question to Monica. She was suggesting not to use the blow dryer, and I've been using it for 30 years. So if you cannot live without a blow dryer, what is the best quality of the dryers that you need to buy? So if she can comment on that, it is not possible for me to live without it. For 30 years I've used it.
Ma'am, there is a mode of cool air in the dryer.
Exactly.
So
That is what is important.
suggest to go for the cool air, but then how do you do that?
No, ma'am, the bounce will come. Acha, you need to curl them always.
No, I mean, I'm used to it always I dry. You've never seen me without a non-drier.
Most of the time you use on the cool air mode, and when you are like applying it, then you use on the hot air.
So
Like I
just
used to keep using, but now I use only cool air because I've been injecting my scalp.
People are talking Dyson as compared to the other one, which is iconic. Any idea about it? Is Monica there who was giving the lecture?
Ma'am, I will not be able to comment on the quality, but the best method to blow dry is allow your hair to actually dry down a bit and then use the blow dryer so that it does not need a lot of heat to completely dry your hair. So, and of course, from a distance, and of course, as less heat as possible.
And can you suggest the spray which you said, the protective spray, how much pumps you should use and where exactly you should use? Because the stylist just puts 2 pumps first. I mean, I'm not sure how much pumps he should be using of the hair protection.
You will need to give me some time to find this out exactly
Fair
from the dermatologist friends, because that will just be a supposition. But I will definitely find this out and get back to you.
Thank you so much.
Give
Sincerely.
us the name also, Monica, of the hair protective spray.
We buy the L'Oreal. That's the one which is
hair protective spray.
Yes, ma'am, that is the best for now.
Yeah.
And Streaks is also available in market, ma'am. Streaks. There's one brand.
Yeah, most of the serums, good serums are from Streak.
Yes. So just few lines concluding. हाँ, आप आए तो बहारों ने लुटाई खुशबू, आप आए तो बहारों ने लुटाई. नीला मैम, ध्यान दें, and all the beautiful WPW office bearers, Sangita ma'am and all. आप आए तो बहारों ने लुटाई खुशबू, फूल तो फूल कांटों से भी आई खुशबू. Thank you very much for a very interactive session, and over to Anuradha ma'am and Sangita ma'am.
Thank you, all the speakers. All of you were superb, simply brilliant. And thank you, Nirupama ma'am. Now it is a time of proper vote of thanks, and it will be delivered by our own Dr. Monali Sonavane ma'am. Dr. Monali, over to you.
Yeah, thank you. Really very very wonderful sessions. मैंने तो बहुत एंजॉय किया और अभी निरुपमा डॉक्टर निरुपमा मैम ने माहौल बना दिया है. स्टार्टिंग में भी कुछ लाइनें बोली, जाते जाते कुछ लाइनें बोली, तो आई रियली वांट टू से सम लाइंस आल्सो. कैन यू परमिट? माहौल तो ये बना रहना चाहिए ना मैम. तो आई रियली वांट टू से सम लाइंस नाउ. तो आखिरकार इस सफर की दूरी हो गई है पूरी, आखिरकार इस सफर की दूरी हो गई है पूरी, बस एक बात कहनी रह गई है जरूरी, बस एक बात कहनी रह गई है जरूरी. शुक्रिया, धन्यवाद, थैंक यू. So good afternoon everyone. On the behalf of the Women Pediatric Forum, I, Dr. Monali Sonone from Udaipur, Rajasthan, would like to extend our heartfelt thanks and gratitude to all the esteemed members and to all the WPF members who contributed to make today's session a grand success. First, I would like to thank to our Women's Pediatric Forum Executive Committee, Dr. Hema Bindu ma'am, our founder and chair of Women Pediatric Forum, most energetic, यहाँ पे है मैम, डॉक्टर संगीता लोधा मैम. मैं मैडम को ही ऑब्जर्व कर रही थी कंटिन्यूअस. Our chairperson, WPF. Then Dr. Elizabeth ma'am, vice chairperson. And of course, my lovely Dr. Anuradha ma'am, honorable secretary. Dr. Shri Lekha ma'am, joint secretary. Dr. Narmada ma'am, treasurer, WPF. And all our distinguished guests for honoring us with your presence and sharing your perspective and experience with us. Now, a big thanks to our esteemed speakers, Dr. Smita Murli ma'am, Dr. Roli ma'am, and Dr. Monica Sachdeva ma'am for enhancing our knowledge and making this webinar so interested and informative. Really, we enjoyed a lot. Very important. And we are also very grateful to our moderator, Dr. Nirupama Pandey ma'am, for guiding us throughout the session. And yes, nothing would have been possible without the hard work of our organizing team and everyone backstage. Last but not least, a big thank to everyone, each and every one of you, your active participation throughout the session. And yes, my special thanks to Dr. Anuradha ma'am for giving me this opportunity and platform. Thank you once again, and we look forward to many such interesting and interactive sessions ahead in New Year. So keep laughing. Laughing से अपनी स्किन अच्छी हो जाती है. अभी मैडम ने बोला तो we will keep laugh, we will smile. So happy New Year to all. Thank you.
And
Thank you, Dr. Monali.
to our tech head, Miss Pallavi Dharmadikari. And for 2025, we have fixed her for the whole year throughout the webinar. She will be with us. And thank you, Pallavi. You have just cooperated and presented very well all the slides and everything. So thanks to you also.
Please switch on your cameras for a group